Welcome back, everyone. Dr. Alex Spinoso, another episode of Medical Mondays, and I'm going to talk about something I get a lot of questions on that I know a lot of my bodybuilder friends have been wanting me to talk about for a while, and that's the subject of Sarms. So what are Sarms? Sarms are selective androgen receptor modulators. SARM, S-A-R-M. And these are oral pharmaceutical drugs that kind of mimic the effects of testosterone on the body. Now, these are labeled as the, quote, legal steroid to a lot of bodybuilders online and everything like that when you order it. The reason is you can usually buy these things online, and they're usually labeled as drugs that are for more experimental use or for studies to be performed and not actually for human consumption. SARMs are relatively new. They've only really come out since early 2000s, and they've become so popular in the bodybuilding world because they give you more, quote, bang for your buck, meaning that they have less side effects that we see in anabolic steroids, and they're also much less expensive than anabolic steroids. So bodybuilders have been using these for a long period of time in order to have almost the same effects as anabolic steroids without the side effects. So how do they work? SARMs work by binding to the same exact receptors in the body that testosterone would. So your body thinks that it has a higher amount of testosterone. When it thinks it has a higher amount of testosterone, it acts the same way as it would if you were taking anabolic steroids or had really high testosterone, meaning it increases your metabolism and it increases your ability to build muscle while cutting fat. Normally, SARMs are used to increase muscle mass and increase bone density in older patients or in patients that have diseases such as cancer where their muscles just start to be eaten away by the disease. A lot of studies show that these SARMs also do not have the negative side effects that most anabolics have, such as virilization in women, that's hair growth and your little buddy downstairs growth. It also doesn't have deepening of the voice. It doesn't have that roid rage or psychosis that anabolics are associated with, as well as a lower decrease in your HDL or your good cholesterol in the body. So it can increase muscle mass, it can increase bone density, it seems to have less side effects than anabolics. What are the bad things about SARMs? Well, the bad things about SARMs is that they're still pretty much illegal. The Food and Drug Administration, or the FDA, hasn't approved them for use in most humans, as well as, just like we talked about with the peptides, they're illegal for use in the NCAA sanctioned sports and any professional sports. And there's been multiple professional athletes that have tested positive for SARMs that have actually resulted in large fines as well as game suspensions. So the MLB, the NBA, the NFL, the NHL, all these sanctions actually ban the use of SARMs. There also are some studies that show that if you take SARMs in large amounts, such as a bodybuilder would or anything like that, the side effects almost equal that of anabolic steroids. So using the SARMs actually resulted in the same amount of side effects as if you were taking an anabolic steroid when you're taking mega doses of the SARMs. Lastly, and the most important thing I think, is that most of these SARMs are sold online by pharmaceutical companies from around the world. There was a study performed in 2017 where 44 SARMs purchased from various pharmaceutical companies all over the world were tested using the World Anti-Doping Agency criteria. And what they found was pretty concerning. Of these 44 different SARMs that they purchased online, only 52% of the 44 actually had the SARM that was on the label inside the bottle. 39% actually contained an unapproved drug that wasn't on the label of the bottle. These were growth hormones, anabolic steroids, things like that were actually in the SARM bottles. So what you thought you were taking was completely something different and much heavier, leading to more side effects. 9%, almost 1 in every 10 bottles, didn't contain any active substance at all. They were pretty much placebos that people were taking. And in the end, only 40% of the 44 bottles tested contained the active compound SARM that was on the label. So there was a huge mix of illegal anabolics, SARMs that actually weren't inside the bottles, and bottles that didn't contain active substances in these SARMs that were purchased online. So you never know what you're going to get when you purchase these online. So that's the short information on SARMs. I hope you enjoyed this video. Please comment, DM, email me your questions. I appreciate everything. I'm going to answer as many as I can in videos, but I will answer all yours personally before I make a video, so you're never waiting to have your question answered. I am Alex Spinoso. This is Medical Monday. Thank you for watching. I'll see you next Monday.